Dear audience, welcome to my 15-month progress report, where I present my projects that help strengthen the relationship of acute pancreatitis with cancer. My name is Jimin Lee, and I'm currently a second-year PhD student with the Center for Translational Medicine, where my vision is to improve the prognosis of cancers. To achieve this, my current mission is to determine the association of acute pancreatitis with various cancers. So currently I have two ongoing projects. In both projects, I aim to assess the association between acute pancreatitis and various cancers. My first project, which is conducted with the methodology of a systematic review and meta-analysis, I'll be looking into the association with pancreatic cancer, whereas in my second project, I'll be looking into various cancers that can be found within the registry that is provided by CTM and also Semmelweis University. So in my first project, I'm investigating the effect of acute pancreatitis to the development of pancreatic cancer. So why is this important? Despite the advances in medical technology and clinical practice, pancreatic cancer continues to be a deadly force within the medical field, where it is currently ranked 7th among causes of cancer-related deaths and is expected to be the second leading cause of cancer-related mortality by 2030. On the other hand, acute pancreatitis is the most common gastrointestinal disease requiring acute hospital admission, and it has increased an incidence of 3% over a 50-year period and has been increasing even further. So, with both of these conditions being very prominent and increasing annually, it comes to the question, are these possibly linked or associated with one another? There has been proposed theories of a bidirectional relationship between acute pancreatitis and pancreatic cancer, where on one hand, the inflammation from the acute pancreatitis can cause DNA damage and mutation, resulting in a pro-neoplastic event. Whereas in pancreatic cancer can cause a tumor mass effect, which occludes or obstructs the pancreatic ducts, causing the buildup of pancreatic enzymes and causing all the digestion and the inflammation of the pancreas. So our aim is to investigate the risk of pancreatic cancer among acute pancreatitis patients. So to investigate this issue, we formulated the following structure or framework, where we want to analyze the general population and compare those who have acute pancreatitis to those without, and assess the risk of pancreatic cancer. And we believe that acute pancreatitis will increase the risk of pancreatic cancer. At the same time, we'll also be able to evaluate the prevalence of pancreatic cancer in the acute pancreatitis population, where we believe that acute pancreatitis where there will be a higher prevalence of pancreatic cancer in the acute pancreatitis patients. And we also wanted to conducted a subgroup analysis where we want to assess the different risk factors within the acute pancreatitis patients to see if they will augment the development of pancreatic cancer. So the systematic search was conducted in 3 different online databases on October 11, 2023, with the search key shown below. From the main selection, we had 54 text-eligible articles, and from the reference tracer, we had an additional 8 articles. And so in the next few slides, I would like to present my results, which shows the significance of acute pancreatitis in pancreatic cancer. So in my first figure, we have the graph that shows the pooled hazard ratio along with the incidence rate ratio, where on the y-axis you see the risk rate of pancreatic cancer, where any values greater than 1 suggest there's an increased risk of pancreatic cancer. And the x-axis we see the time or the follow-up after the first episode of acute pancreatitis, where the time 0 is considered the first episode. And as you can see in the graph, the risk rate of pancreatic cancer is the highest near the diagnosis or the episode of acute pancreatitis and gradually decreases as the follow-up time increases as well. This can suggest that acute pancreatitis can be more likely a symptom, but we can't ignore the fact that there's an increased risk even when they were followed up for many years. In the next 3 figures, I want to break down based on the different follow-up periods, and in this figure, we assess the long-term risk of pancreatic cancer in the acute pancreatitis population who were followed for more than 5 years. Where any hazard ratio greater than 1 suggests that there's an increased risk in the acute pancreatitis population, and less than 1 suggests that there's a decreased risk. And this result was adjusted for different confounding factors such as age, sex, smoking, and alcohol. And we had a pooled hazard ratio of 1.95. This tells us that acute pancreatitis patients are 2 times more likely to be diagnosed with pancreatic cancer when they were followed for more than 5 years. And this result is both mathematically and clinically significant. Next, we assessed the middle-term risk, where the patients were followed for around 2 to 5 years. And here in the pooled hazard ratio, we have a 3.37. And this tells us that acute pancreatitis patients are 3 times more likely to be diagnosed with pancreatic cancer when they were followed for 2 to 5 years. In the last hazard ratio figure, we assessed a short-term risk, where we found that the hazard ratio was 53.327. And this tells us that the acute pancreatitis patients were 50 times more likely to be diagnosed with pancreatic cancer close to the AP episode. And this result is both clinically and mathematically significant. And in the next 4 figures, we assess the odds ratio of the pancreatic cancer in acute pancreatitis patients with different risk factors. In these 2 figures, we assess the smoking and the diabetes mellitus, where any odds ratio greater than 1 suggests that there's increased risk, and less than 1 suggests that there's decreased odds. And for those who smoke, there's a 42% increased odds, and in diabetes mellitus, there's a 27% increased odds. While these results are not statistically significant, but they can be clinically relevant, as there's a slight, as you can see, a tendency within the studies that favors the increased risk of pancreatic cancer. In these next 2 figures, we assess the chronic pancreatitis and also the effect of alcohol within these patients. And in chronic pancreatitis, we see an odds ratio of 3.50, which suggests a 250% increased odds of developing pancreatic cancer, which is kind of expected, as we know that chronic pancreatitis is a known risk factor for pancreatic cancer. And for alcoholic, we have 53% decreased odds. And while chronic pancreatitis result is significant and clinically and mathematically significant, the alcohol is both non-significant. And to conclude from our results, we can say that acute pancreatitis is likely a symptom of pancreatic cancer, but we can't ignore the fact of the middle and long-term risk for pancreatic cancer as well. Some risk factors that we have to consider within these patient groups is the chronic pancreatitis, diabetes mellitus, and smoking. For practice, we need to polish the follow-up strategy of acute pancreatitis patients for signs of pancreatic cancer, taking into considerations of the various risk factors that these patients may have. And for further research, it is highly recommended that we do a more long-term relationship to assess the long-term relationship between acute pancreatitis and pancreatic cancers, and this can be done by prospective longitudinal studies. So this is the current progress of my first project. I just received my final figures a few days ago, and I'm currently working on the manuscript. And for my second project, I'm investigating the effect of a pre-existing malignant tumors on the outcome of acute pancreatitis. So an article that was published by a colleague here at CTM, they found that the first-year mortality rate in acute pancreatitis patients after discharge was almost doubled compared to the in-hospital mortality rate, with age, comorbidities, and acute pancreatitis severity being the most significant risk factors for the death. They also found that acute pancreatitis-related mortality rate was 9 times higher in those patients who were older than 60 years of age. And on the figure on the right, you can see that one of the most significant causes for the death was an end-stage cancer-related comorbidity. So our aim is to investigate the effect of pre-existing malignant tumors on the outcome of acute pancreatitis. So with this being a registry analysis, we'll be able to evaluate several variables. So we constructed 2 different clinical questions, where the first question is we want to assess the prevalence of pre-existing malignant tumors within the acute pancreatitis population. So this pre-existing term can be the tumors diagnosed before or after the acute pancreatitis episodes. So in the clinical implication, we can increase the awareness of these acute pancreatitis patients of having a pre-existing malignancy. And for the second clinical question, we want to see how this affects the outcome of acute pancreatitis patients, where we compare the patients who have pre-existing malignant tumors to those without, and assess some outcomes such as hospital mortality, ICU admissions, complications, and length of hospital stay. In the clinical setting, if we find the hypothesis to be true, we can closely monitor the subpopulation of acute pancreatitis who is at high risk of having these complications and treat them accordingly for a much better outcome. And so this is the current progress of this project. I received the data that was extracted a few days ago, and I have to work on cleaning the data because the original database had a lot of missing data regarding the cancer. And so to summarize, I have 2 ongoing projects which revolve around the association between acute pancreatitis and cancers. I want to have my first project submitted by this coming month, next month, and the second project by this coming fall. And to end, I would like to quote Marie Curie, where she says, "Nothing in life is to be feared. It's only to be understood. Now is the time to understand more so that we may fear less. Cancer is a terrifying disease because its nature is poorly understood. With my studies, I hope that we can better understand the nature of cancers through the association with acute pancreatitis so that we may fear less." Thank you for your attention.
congratulations for these clinically relevant data and results. My question relates to your second topic. And so what do you think why acute pancreatitis is more frequent in patients with previous malignant diseases?
I wouldn't say it's more frequent, or at least we don't know yet. I'm just saying we're just trying to figure out if pre-existing malignant disease are frequent within these patient groups. But of course, malignancies can have lots of effect on our bodies, affecting different organs as well, which can also lead to maybe resulting in acute pancreatitis. But I'm not entirely too sure about the exact mechanism, unfortunately.
Is there any question from the floor, from you?
Congratulations, Jimin. I have a question regarding your first study because we can see that the risk of pancreatic cancer increases after acute pancreatitis, but currently, as far as I know, there is just a small proportion of patients for who they recommend the screening. And what would you suggest based on your results? First, how would you screen the patients and how frequently?
That's a really good question. I think it really depends. I think more studies should be done regarding the long-term relationship between acute pancreatitis and pancreatic cancer. And also we should determine which etiology we should look out for. There's been some studies done on the idiopathic pancreatitis suggesting that there might be an increased risk in this patient group rather than alcoholic or gallstone-induced pancreatitis. But I think I'm not a clinician myself yet, but I think it will be feasible to do CT scans regularly, maybe annually, within this acute pancreatitis patient group. But we need further studies to determine the exact relationship.
Congratulations. My question is that in the first project, you included several etiologies of acute pancreatitis, but not all of them. And what is the reason for that?
Thank you for your question. There just wasn't enough data regarding this, so yeah.
In your first project, did you include any or all of the acute pancreatitis patients with different etiologies, or just the idiopathic cases?
With different etiologies, but as I mentioned, there was not enough data to differentiate or to conduct any sub-analysis between them.